Zimbabwe National Family Planning Council, ZNFPC, is a non-profit making parastatal under the Ministry of Health and Child Care. ZNFPC has a mandate to coordinate, take leadership, and support implementation of integrated family planning and related sexual reproductive health services in Zimbabwe. The organization operates in all the 10 provinces of Zimbabwe through 4 service delivery channels, which are static clinics, community health workers, youth centers, and outreach programs. The Zimbabwe National Family Planning Strategic Plan 2022 to 2026 is the guiding document in the provision of quality integrated family planning, sexual and reproductive health, as well as HIV and AIDS information and services. In 2023, the Zimbabwe National Family Planning Council also successfully participated and co-hosted the International Interministerial Conference on South-to-South and Triangular Cooperation in Population and Development, held at the Elephant Hills Hotel and Resort in Victoria Falls from the 9th to the 10th of October. The conference was graced by His Excellency, the President of the Republic of Zimbabwe, Comrade Emmerson Mnangagwa. Also, in the year 2023, the Zimbabwe National Family Planning Council managed to hold an annual general meeting in compliance with the Public Entities Corporate Governance Act, which states that as a public entity, Zimbabwe National Family Planning Council must convene an annual general meeting. The Zimbabwe National Family Planning Council made significant progress and strategic advancements in delivering family planning and sexual reproductive health services within Zimbabwe. Despite facing challenges such as skills flight and economic obstacles, the Council displayed resilience, innovation, and commitment to its mandate. In 2023, there was an 8% increase in the total number of family planning clients served compared to 2022, demonstrating the organization's dedication to expanding access to these services for women of reproductive age. Additionally, the Council provided various sexual reproductive health services beyond family planning, including HIV testing, STI screening and management, reproductive cancer screening, fertility management, and information dissemination. The Council's service coverage remained commendable, reaching even remote areas through outreach programs and community-based workers. Collaboration with government agencies, implementing partners, civil society organizations, funding partners, and the private sector amplified its impact and reach. Upholding high standards of care, the Council trained over 800 health service providers, ensuring safe and client-centered services tailored to Zimbabwean communities' diverse needs. Family planning coordination meetings were organized, facilitating collaboration and knowledge sharing among stakeholders at both national and provincial levels. Operations research and quality assurance exercises were also conducted across all provinces, ensuring service excellence and informed decision-making. In its quest to recognize the importance of male involvement in reproductive family planning and other health initiatives at large, ZNFPC actively engaged male champions in promoting and supporting family planning efforts. Efforts to involve men in family planning and health initiatives were evident, alongside advocacy campaigns and community dialogues involving political, traditional, and religious leaders to promote positive attitudes towards family planning and reproductive health services. Community sensitization programs enhanced informed decision-making and access to essential services. In 2023, the Council intensified efforts to empower women and youth with comprehensive reproductive health information, leveraging partnerships with local organizations and digital platforms. Despite resource constraints and operational challenges, the Council demonstrated resilience and adaptability, sustaining essential services and mitigating disruptions. ZNFPC had to weather a number of challenges that included, but are not limited to, delays in delivery of commodities as well as inadequate order filling, staff shortages also negatively impacted the organization. The family planning program experienced a shrinkage in donor support, leading to funding gaps in areas such as IEC materials production, IUCD packs, and cervical cancer screening equipment, amongst others. To counter these challenges, ZNFPC engaged the government of Zimbabwe, stakeholders, and partners to increase domestic funding of the family planning program and strengthen the supply chain to ensure availability and security of all family planning and sexual reproductive health commodities. Looking ahead, ZNFPC reaffirms its commitment to provide rights-based, quality integrated family planning services, aiming for zero unmet need for family planning services in Zimbabwe by 2026. Building on 2023 achievements and lessons learned, ZNFPC remains prepared to address emerging challenges and realize its vision.